A little spinning wheel. Good day, everyone, and welcome to today's webinar, Reimagining Facility and Compliance Funding, Unlocking Cost Savings, Regulatory Performance, and Reimbursements Through Strategic Upgrades. Our speaker today is Chad Courier for CEG. At this time, everyone is placed on mute to prevent any background noise. We will have a question and answer period at the end of the presentation. You can type your question using the Q&A icon. They will be answered in the order they were received. Please identify the name of your organization at the beginning of your entry. Also, as a reminder, a copy of today's materials can be found in the registration link. Email me, Michelle Schaefer, if you are not able to access the PowerPoint, and I will send it directly to you. This webinar is being recorded and will be available on the CIHQ Webinar Partner YouTube page within a couple of business days. You do not receive continuing ed units for this webinar. It's my pleasure now to turn the conference over to our speaker, Chad Courier. Chad, you have the floor.
Thank you, Michelle. And we appreciate the partnership with CIHQ and the opportunity to participate in the webinar today. And appreciate everyone's time. So, welcome today. I think this is a great way to spend your lunch hour. So today, as Michelle mentioned, we're actually gonna go through how to rethink how you and your leadership teams look at facilities, not as cost centers, but really as strategic assets. It can reduce infections, save millions of dollars, and even improve patient outcomes. We understand you face daily challenges, whether it be rising costs, shrinking budgets, compliance burdens. Those aren't just facility, those aren't just compliance problems. Those are really enterprise risks that are hidden in a lot of the systems that you have in place. And so some of the ability to address those might actually be present in your hospital or in your healthcare system. And so we're going to go through some of those today. So initially, we'll go through some of the hidden crises in healthcare facilities. As I mentioned, shifting from cost centers to strategic assets, and talk about how really using data-driven opportunities to address those needs and really do so without having to come up with upfront capital. And then walk you through a potential implementation roadmap of how you can actually take action to address some of these issues that we talked about today. So I'm Chad Courier, currently live in Kansas City, Vice President with CEG Solutions, and our company is headquartered in Arlington, Virginia. I've been doing this for a little over 20 years, dealing with multiple industries, really with complex environments and alternative contract and financial structures. So our team has worked with a lot of clients, specifically in mission critical environments, to help identify ways to create a cost-effective path to address needs that typically you wouldn't be able to address relating to compliance, regulatory environments, and facility operations. We actually worked with a state hospital in California, where we saved them $35 million that they were able to redirect back into upgrades without any upfront capital, completely paid for themselves, and took care of a lot of critical needs that they had regarding aging infrastructure and even addressing unplanned downtime and potential disruption in services. So we'll go through today how you might be able to look at similar opportunities to be able to take some of those steps. So initially, some of the hidden crises in facilities, start by looking at the reality of many of you live every day. And some of your hospitals may fall into these categories where in 2024, Healthcare Facilities Management did a operations survey where they looked across 5,000 hospitals across the US. What they had identified is 68% of hospitals are older than 30 years, and nearly half are older than 50 years. Yeah, you're probably in a lot of you are probably in those hospitals, and it's not surprising to you, but if you really think about it, with a lot of those older sites, how many of those building systems are original to the building, or at least partially as old as that building? And then how many of the hospitals that you are in or have been in have done expansions that they've really just bolted on new square footage to some of the old systems? that's just adding stress to what was already there. So what we want to do is look at how we can take advantage of those and take a holistic approach to maybe improve some of those potential scenarios that are contributing to some of the compliance challenges that you have. Additionally, as part of that study, they identified that between the years of 2022 and 2023, that maintenance and utility expenses rose exponentially. A lot of other costs, labor, other benefit expenses, a lot of others went up as well. But if you see that red block at the bottom, unfortunately, that's where funding was actually going down. So that means that you're being asked to do more, even improve the quality of care, compliance, and safety with fewer resources and aging infrastructure. Yeah, that's often what we see. It's a very common challenge, and that really results in what we've referred to as deferred maintenance, reactive maintenance, where the teams can't really spend the time going out and addressing and being proactive. They're just reacting because they're putting out fires all the time. Unplanned breakdowns, emergency repairs, and really last minute workarounds that you're trying to do as well. So when it comes to some of the compliance and hospital-acquired infections, this study here shows what some of the more common infections are. This probably isn't news to you, but what you can see is the average cost for each of these. And when 1 in 25 patients are suffering or impacted from hospital-acquired infections, that's a significant challenge and a significant impact. And as we continue to look at, over $360 million in medical reimbursement penalties, per year are often seen through a number of hospitals. And I know that a lot of you are probably facing those same challenges. And hopefully you're not drifting into that bottom quartile that gets that additional 1% reduction in Medicare payments. That the status quo and the challenges of that is just becomes more expensive and starts to get even worse. So now the question becomes, what can we do about it? How do we break this reactive cycle, improve performance, and pay for it in a way that makes financial sense? That's where we look at the new approach of one that uses data, strategy, and even guaranteed savings to be able to fund the improvements that you desperately need, that otherwise there's that continuous challenge for competition for capital. And so if we can take and reframe that discussion and really move the facilities and compliance from a cost center over to a strategic asset, we can actually generate those funds to help offset some of that cost. And so in looking at the transition from reactive to proactive maintenance, I mean, you've seen it before where you're relying on reactive maintenance systems. They're aging, staff is stretched thin, there's constant work orders that are being put out of fire, yet still you're trying to maintain the patient care and the competitiveness of continuing to provide that quality of care that everybody strives to do. And unfortunately, deferred maintenance is kind of like compound interest, right? Except it goes in the reverse. It goes the other way. And you have, where as you continue to be reactive and the systems continue to get older, what happens is they continue to get worse and worse. So it's difficult to get yourself out of that hole. And it becomes, it becomes very stressful and, an unfortunate situation. But really doesn't have to be that way. We can actually transition where by making certain strategic upgrades, we can both impact on the maintenance side, the cost of maintenance, and move from that reactive to proactive model. We can impact potential regulatory challenges. I'll talk a little bit later about a case study example at which we were able to address some of their critical care areas where they had difficulty with temperature and air changes. We're able to address that with them. And then also the costs of hospital-acquired infections, whether it's a penalty or whether it's just a cost of care from doing that. If we can basically get all these into a singular holistic conversation, we can make improvements and put systems in place that enable you to leverage some of the costs that right now are occurring in your hospital and redirect them and reinvest them back into the infrastructure. This slide here is an example of an actual hospital case where a air purification system was used and data was studied on hospital-acquired infections. And so as you can see, they studied four HAIs over a period of time. And from the time that it was installed, they noticed a 70%, over 70% reduction in the hospital-acquired infection, which over a 21-month period reduced by over $300,000. And that really was not a large case study that they did, but it was very good set of data points that they were able to glean. And there's multiple types of air purification systems. There's a few of them that, in our opinion, works, better than most, and it really depends on the application that you're looking at. But it's very much within reason that you could take a step similar to this and select certain areas within the hospital that are more susceptible, put a similar application in place, and see similar types of reductions. I mean, we often see, 20% up to 70% in reduction in the hospital-acquired infections, and there's data to support this. And it really comes down to being able to do the analysis up front, identify where it's going to provide the best application, and then be able to track that. But that's one way that you can make a significant impact in reducing some of the hospital-acquired infections that you might be dealing with on a monthly and annual basis. So really a discussion around how we make the shift from the reactive to the proactive maintenance, and also begin to get our arms around tying in how we can impact the regulatory and compliance side of it as well. And there's, as we all know, there's really three key roles within the hospital and the system that we want to think about. And obviously, that's compliance, clinical quality compliance, healthcare quality control. Also, facilities maintenance. I know that you work arm in arm with the operations staff and the facilities maintenance staff. And then finally, the financial team, the CFO. And what I often say is that the only thing worse for a CFO or a controller than not investing in something is putting a lot of money into something and have it not work right. That makes it even more difficult. So through this this slide that I have up here, an approach that you all can look at, and some of you may have already embarked on some of this, is looking at what's called a facility condition assessment. And through that, that's where do a detailed analysis of the systems and equipment throughout your hospital, and really pull back the data on their age, their type, their performance. And it starts to build in the data supported information that you need to start making better decisions and really get your arms around the condition of the systems throughout the hospital. And that gives us actually a roadmap that we can start looking at where the priorities are. Within that also, we can also look at energy efficiency improvements throughout the hospital as well. And what we like to do is target specific areas. If you look at where are your main compliance challenges, the regulatory issues that you might be facing, oftentimes it may result in, hospital-acquired infection. It could result in, on your assessment, getting negative marks on your assessment, at which you have to go out and build a plan to actually address that. And so by taking a holistic approach of one, looking at the systems and pulling data back specifically on what they are in their condition, you can actually build an index. And then by taking a further step and identifying and prioritizing where are your critical pain points, where are the critical needs that you have to address. And from within that, then we can actually run calculations to determine what type of savings and efficiencies may be present. And those efficiencies could be within energy, They could be within operations. There's oftentimes very costly repairs that are having to be done, very costly subcontracts that are maybe in place that may not need to be if the systems and the infrastructure were in a better condition. And then finally, there's the compliance regulatory side at which you may be getting the unfunded costs or the even worse so, the penalties. But if we look at it from that holistic approach and gather all of the data, we can then come up with a detailed roadmap that we can sit down and determine what the priorities are and what a potential approach would be to be able to address these. And so by developing the condition assessment and doing the system level evaluation to identify what could drive savings, now we can look at those system improvements and actually do calculation to determine, based on that savings, how can we reinvest it back into the infrastructure to actually fund these upgrades and limit the amount of capital that you have to come up with to fund the improvements. And that's typically is a lot of you that are on the webinar today probably run into, where you're able to identify what's the issue, what's the primary contributor to that, but then there's that competitive cost of capital, right? Where do we come up with the funding and where do we come up with the justification? And so a lot of challenges is that individuals or teams are forced to look at it as a singular symptom. And what we want to do is we want to recommend that you go in and you look at it as a more holistic approach to build that roadmap out, because what you'll find is that a lot of the costs that you could reinvest and use to offset the capital required, a lot of the costs are already present. You're already making those expenses. So there are programs available that you can research and identify that actually enable the hospital to finance these upgrades. Now, there's a lot of work that goes in up ahead of that, but it can make very much simplify it. Take that work off your plate. There are teams out there that'll do that upfront analysis, do that condition assessment, and then that detailed energy audit. And from identifying that savings, now you can do a financing path that there's things called energy as a service, which is where the program is financed and you really only pay for what you save. And that becomes an operational expense as opposed to a capital expense. So within your finance and accounting department, they often like to take that route because it doesn't impact the amount of revenue to debt and capital that they have. So it really frees up what they can continue to do from some of their other investments. And so rather than sitting in a room and discussing, do we invest in this Gamma knife or this MRI machine, or do we continue to do maintenance or make needed improvements throughout our system, you can actually turn that and into an or and say, turn that or into an and, where you're able to do both of those because you can now come in and generate the funding through the savings that are already present and already within your budget. So as this graphic shows here, the first block, that first column that's in blue there, that's your current energy and operation and maintenance costs. You could also include in there any type of unfunded care that you have to do or penalties through HAIs. The second block is really when you do that type of a program, whether it's energy as a service or something similar, where the savings, the reduced energy and operation and maintenance costs actually goes in to pay for the debt. So as that prevents the need for the upfront funding and enables you to actually do the improvements. And oftentimes with those, there may be a performance guarantee or some type of measurement and verification at which you can be very transparent on the data and the outcome so that you see what that performance is. I showed you that slide a little bit earlier on that hospital where they did the air purification and they had the data to support that. This is very similar. By putting in the right building technologies that you're going to utilize to improve the systems, you can actually track that savings that shows where the performance is based on what the upfront estimates were. And even a lot of firms, ours is one of them, a lot of firms will actually guarantee that performance. So if you don't hit the savings, then it's up to them to come in and identify and make the needed changes so that the hospital can make those, because the intent really is that the savings is going to offset the debt service. Any additional savings can go right back into the hospital's budget. And after the contract is complete, after the savings term, all the savings, all the equipment, everything is retained by the hospital. There's no ongoing requirements or anything from that. It turns right back over to the hospital at the end of the term. So part of what that can do is that gets you that holistic view, enables you to take the needed investments or make the needed upgrades through the investments that you've already been making, rather than pay them to the utility for energy costs, or rather than pay them to a bunch of subcontractors to do reactive repairs. You actually take that and reinvest it back into your infrastructure. And that's where you start to make the transition. That's where we start to transition from the reactive maintenance to the proactive maintenance. Because now a lot of those fires that they've been chasing and trying to put out, they're no longer there. You have technologies in place that allow the staff to do more with less. And the infection control nurse that up in the OR, that individual can actually see through the systems in place how everything is performing. So there's no concern of having to take additional measurements, or maybe you're not in compliance. Right there, because you have the systems available and in place there. So as we're looking to convert these costs to investments and looking at some of those key roles, again, I'll go back to some of the key points there. If you think about how we take this full hospital system and holistic approach across, within your hospital, all of the systems within your HVAC, as well as what you utilize for compliance. If we can put the disinfection systems in place that can reduce potential HAIs by 20 to 70%, that right there is a huge impact. You're going to reduce your penalties and improve patient care, right? Also, from the maintenance side, do the condition assessment to get the data to either provide the justification or at least give us that idea and that roadmap, so you know what you want to go after for priorities, and be able to go after that infrastructure improvements that's going to enable that transition to proactive maintenance. And then finally, from the financial side, as we're trying to determine, and you meet with the executive team to determine what you can move forward with. Now you're looking at the data supported information that help you make better decisions. And also can point back and say, here's why we did it. And then after the fact, you can go back and say, here's what it did. And a lot of times it'll overperform what you actually thought it was going to do. Then you start reducing those premium costs for the emergency repairs, for the unplanned emergencies. As you saw in an earlier slide, those unplanned emergencies are typically about 18% more expensive than the planned maintenance that's done. And so as you start looking at the 20 to 70% reduction in HAIs, the energy and operational savings, it's not uncommon to find 30 to 40% in energy and operational savings within the infrastructure. And then finally, you start removing those emergency and unplanned costs. You start adding all of those up, and then maybe even be able to get some grants and incentives. You start adding all of those up and put that into a finance opportunity, you can actually make a significant investment or a significant impact. As I mentioned, we did that hospital in California, and they did self-funded $35 million in improvements, all with costs that they were spending that was right there under their nose the whole time. So really start to take those dollars you're already spending and reinvest them. This here is an example of a case study of a program that I worked on that was with a Common Spirit Hospital. It actually was, some time ago, so it was CHI at the time. So that gives you an idea of, how long ago it might have been that we did this program. But it was a 200 bed hospital, good sized hospital, and the staff had difficulty maintaining some of the temperature, humidity, and air change levels in their critical care and treatment areas. And so, as you can imagine, they were looking right down, potentially getting, cited for those. And, but they couldn't figure out how to address them. So they continued to spend this money over and over on wasteful spending and repairs. And they had been told that they needed to make a significant investment in expanding their central plant, but they just didn't feel that they had the data to actually, invest in that, and that was actually the issue. And when we got in, we went in and took a holistic view, looked at all their systems, and by doing so, really gained an understanding of where their key challenges were, and did an analysis, a condition assessment of the systems in place, and identified they really had the capacity that they needed. They had the systems in place that they needed. So adding more wasn't going to address the issue. Unfortunately, not long after we were embarking with them on the study, they were actually cited for not maintaining within the parameters around those three areas of temperature, humidity, and air change. And so we had to quickly pull together a plan of which they were going to be able to do it, but that had to include money. It's very easy to go in and do an analysis, come up with a bunch of needs, hand them over to folks like yourself and say, okay, go get them, Tiger. Find the money to go get these done. As easy as that, you would have already done it, right? It's a different story to go in, zero in on what the true need is and what the true challenge is, and then find a way to be able to address that, but also put a financial model in place that will pay for itself. That's a completely different approach. We were able to do that, and we're able to find 25% energy savings in making the upgrades. Some of you, from a technical side, may be wondering, what the challenge was they had, and some of you may run into this. I always say, whenever I go past the hospital, there's always a crane outside because they're always adding something to the hospital, right? And as I talked about earlier, some of you that are in those older sites, yes, you may be adding new towers or new ambulatory surgery. But when you do that, that actually stresses the system that's in place. And that's exactly what happened here. Is they added a couple new towers, and the pumping system that was sending chilled water up to the areas in question did not have enough power since it was fighting itself. Also, a lot of the systems were very old and they weren't functioning properly, so they're operating at not full capacity. And so again, it was really, you can't look at a singular issue. It was a combination of things that we had to look at. But by doing so, we were able to generate that savings, did a as a service program where they were able to make the upgrades, fund them completely out of savings, actually had additional savings that was additional cash flow that came off of it. And we made these upgrades, and one of the things we did was we put a dashboard in with the infection control nurse, and they were able to see all of the conditions of their areas, of their treatment areas, and know exactly real time whether they were in the parameters or not. In addition to that, rather than taking manual readings on everything and keeping paper documents, they were able to run reports and maintain those and archive them. So when they did have a reaccreditation survey done, they were able to easily produce that information. And so it was such a big change that the maintenance team, who was commonly used to being up there multiple times a day trying to figure out issues, they stopped hearing from, the doctors and infection control nurse, and they said, is everything okay? But that gets to that discussion then of them being able to transition from putting out fires to now be more proactive. Additional upgrades we made in the central plant allowed them to do that proactive maintenance. And so it was really a change in culture of what they were able to do and be able to make those upgrades. Again, all of the costs, all of the savings was right there under their nose, but it took doing that holistic study of which you all can do and find ways to address some of the key needs, but also uh, be able to create the funding that's needed to be able to address some of those. So now you might be thinking, okay, it's great, that sounds good, but how's that process work? How do we get from, where we're at now to identifying an assessment, and I still have to come up with the funding for that and everything. So you're probably trying to figure out, okay, how does this work? So yeah, let's step through that a little bit. And the key thing that you want to look at is building an actionable plan. So there's something that I want to leave you with. It's taking that holistic approach of pulling in all the parties involved that are the key stakeholders, compliance, uh, facilities management, and finance, and looking at it and determining, building out what that roadmap can be, but then within it being able to identify what's the actionable plan that we can actually uh, make a difference with and take action on now. You're not going to be able to fund everything, but if you can pick the priorities and go after the target and identify the funding there, you can fund those, make the significant impact, reduce some of those penalties, reduce some of those operational costs that you can reinvest. And so here's a low risk path. And so, like I mentioned, some of you may already have partners that you're working with that may do some of these. There's other firms out there. Obviously, this is something that we do. I'd be happy to consult with you on guidance on how to best do this. But the first step, really looking at a low risk path. The first step, looking at a preliminary assessment, and that's something that should be at no cost to the hospital. And really, it's high level information, but it's allows you to qualify and determine, can we identify some of the needs to help us take this approach? Do we have the spending and the waste that we could reinvest back in to take care of the needs that we have? Is it something that can address some of our HAI issues and some of the regulatory issues that we may be cited on? And so, but you really should be able to. You should be able to take that holistic approach, if you're bringing the right partner, to be able to identify what are the key needs and how can we build that roadmap to get there. So again, that's no cost. It's not something that you can really take out and get bids on or anything, but it'll give you a good idea and a good range of what it might take to do that. It's something that you can also discuss up through the executive team as you're trying to identify, can we do this from whether it's supply chain or whether it's, your CFO, is this something that can fit within our model? And if there's questions about it, really, you should be able to hopefully identify, where it's not going to impact your CapEx. It's not going to be competing with other investments that you need to make. There's multiple different approaches you can take that will enable you to do so without having to compete for those funds because you're already spending the money for it. After that preliminary assessment, then you get into something called investment grade audit, and that's really the investigation and the design at which, at that point, you still shouldn't have to pay for that. It could be there's programs where you might commit to it, but whatever cost it takes to do that analysis, at that point, really, through many programs, can just roll into the implementation. And so once you agree upon what the goals are and you're confident that whatever partner you're using has identified the right path, then you can make that commitment, and you're still really not paying until you get into that construction stage. And if they cannot deliver on it, then you also should not have to pay for that analysis because it didn't deliver what they said it was going to. And so then as you get to that next step, you identify the pricing, the savings, the impact to the key areas. Can we reduce the HAIs? Can we address, the regulatory challenges that we're having? And then at that point, you can actually move into the construction stage. And yeah, at that point, if you're financing it, you're still not paying anything because now it's gone through the financing process. So you get into the construction stage where all these initiatives that you've identified are being implemented. And then at the end, you get your commissioning, your checkout, and then there's ongoing measurement performance. And that's really a key part of it because you want to see the measures that you implemented to address your HAIs or the measures that you implemented to reduce some of your cost, are those actually performing the way that they're intended to be? And so there's technologies that are put in place and also other measurements where, as I showed you on those last couple of case studies, that you can definitely record that information and you can have that partner of yours be accountable as well as your teams. They can be accountable because now the information is more transparent. And so there's a little bit of accountability internally within the hospital as well, on your staff. Are they doing the right things? But I'll tell you what, they're dealing with a lot of challenges right now. Your staffs are, you are. And when you actually have the data to support it and you reinvest back into the infrastructure and it shows that investment into those systems, what we find is the teams really become fully bought in and actually become fanatical about running the systems, and they identify more savings opportunities. And a lot of these programs that we're engaged in, at least, they overperform by an average of 13% on the performance and savings and what's projected. And that's really because of the partnerships with the teams. You all are doing a great job. Your teams are doing a great job dealing with the hand that you're dealt. If you're in a 30, 50-year-old hospital, they have the same type of systems in there, and you're adding on square footage. That's a lot to deal with. These programs aren't about trying to point fingers and identify what somebody's not doing. It's really try to help pull the data and bring the narrative forward so that justification, so that the CFO and the executive team and the board can actually be very comfortable making the investment because you have identified the savings that can be reinvested back into the infrastructure. So that's a simple program that, again, it starts with very low risk at the beginning with no investment. And then there's even off ramps throughout the program that you should be able to follow. And so, as we look at, close here on some of these points, and, I look forward to the question and the Q&A session. You're dealing with a lot of challenges. You have aging systems, increasing compliance demands. You're absorbing the financial risk of HAIs, deferred maintenance, reactive repairs. You don't need to keep dealing with these. You can actually unlock some of that savings that's likely hidden right now within your hospital. And so if you take that holistic approach and are able to go in and be able to address from the maintenance side, the compliance side, the financial side, you can build a program. You can build a roadmap to be able to overcome some of those issues. So, from a call to action standpoint, as you leave, I highly urge you to go, pursue opportunities for some of these risk-free preliminary assessments that you can at least identify what some of the potential benefits are. And then from there, that really help paint the picture and the story, kind of the start of a roadmap. It doesn't define the whole roadmap, but it gives you a start of it that you can now engage some of the leadership and, the key stakeholders to start, discussion on, how compliance, facilities, and finance can all relate and turn those excess costs into benefits. Again, take it from, a cost center to, a strategic asset. Potential reduction in HAIs by up to 70%, energy costs up to 40%, additional operation costs, reduced penalties. So they're all there likely right there within, the costs are already being spent. You have the opportunity to reinvest those back into the organization. So with that, I think ready to close and go into the Q&A. So thank you very much for everybody that attended. I hope this provided some insights and it's valuable for you. This is my information. I know that Michelle is going to post the video as well. You can always feel free to reach out to me by phone, by email, or even on our website. We've got a little place where you can say, I'd like to schedule a consultation. No obligation, don't need to do work with us. We really appreciate the partnership with CHQ and its members. So our goal really is just to help get you some of the information and guidance that you can begin taking action and address some of the challenges that you do such a great job of dealing with every day. So again, thank you everyone for your time.
Thank you, Chad. And as a reminder, you can type your questions using the Q&A icon at the bottom. Our first question is actually anonymous, and hopefully you didn't cover it during your series. Is there a quality improvement plan you follow to study the annual performance?
There is. I'm not quite sure. I might ask maybe to expand on that a little bit. So if maybe you want to add a little bit more into that question. But so for the performance, we'd work with your teams to identify what some of the key metrics and KPIs. And I think that's a really good question to ask because we want to make sure that the KPIs align with what you need, especially if you are running into challenges where you might be facing a potential citations on some of your surveys and on your reaccreditation. We want to make sure that we attack the KPIs for those. But from a quality control standpoint, yes, we do have a quality control program that we'll work with your staff on as we're doing the ongoing measurement performance. And again, set a scorecard and KPIs that really are across those three areas that I mentioned. When you have your facilities, you have your compliance and accreditation, and then you have your finance and executive. We actually look at three different methods as we are looking at performance on those systems. If I didn't answer your question, please do a follow up or reach out to me. I'd be happy to expand on that more.
Great, thank you, Chad. Another anonymous, how would we be able to calculate the FCI?
It's actually an industry standard where you take the value of the facility of the site and you take the value of the amount of upgrade needs that are required. So as you do the assessment, you look at the age and the condition of the systems, and that gets a certain rating. And then that gets a dollar impact. And then that dollar impact then is divided into the value of the site itself. And so as you have if you can imagine, a higher level of cost to make improvements results in a higher number when you divide it into that overall value. And so that gives you an index number. And then from there are certain benchmarks of targets that we want to try to get to. And then we can build out that multi-year plan of capital investments, but then tie in that energy conservation impact of where if we can generate, a portion, say we can take care of 20% or 40% of those needed upgrades within that program, then that changes the view. We can show what that index impact is.
Sweta Amin has a question. The QAPI, Quality Assurance Performance Improvement, requires an agenda item from facilities and engineering. Is there a standard template or PI plan a hospital can follow to keep the board informed on O&M and propose/recommend changes to convert cost to investment?
There is. I'll have to admit, Swami, that I don't know exactly that QCPI that you're referencing. So I'll research that and look into it. Yeah. But from the tracking of the information, what we can do is establish the KPIs that are in line with that, so that we can produce that quarterly or biannual update to the board and have that readily available. But that goes right in line with the ongoing measurements and the verification of performance of both the systems as well as the O&M performance that can be both programmed into the technologies that are put in place in the analytics, and then as part of the assessment. So I'm not sure exactly what the KPIs are within which you had mentioned, the QCPI. However, I'm certain that we can, through the analytic programs we put in place, that we can put the tracking mechanisms in place for that.
All right. The same attendee, Sweta, said the QA-PI committee is a board quality committee, and she would be happy to see the dashboard from your case study. I'll get you two connected after if you'd like to continue that.
Yeah, that'd be great.
Okay.
That'd be great.
And that looks like the end of questions. I'll stay on until the participants fall off. Thank you again, Chad, for this webinar today.
Thank you, Michelle, and thanks everyone for your time.